There is a great need for more extensive humanitarian interventions in a world where more than 123 million people are displaced globally. Of this vast and rising number, the UNHCR has recognized over 37 million people as refugees, and the numbers are rising. For displaced persons who cannot return to the country of origin or integrate into the country of first asylum, resettlement is a remaining durable solution. However, this solution is a scarce opportunity. Less than 1% of the world's refugee population is resettled annually. And in the New York Declaration for Refugees and Migrants from 2016, UN member states committed to strengthening and enhancing mechanisms to protect people on the move. And the UN member states have pledged to ensure that, quote, no one will be left behind, and to, quote, endeavor to reach the furthest behind first when pursuing the Sustainable Development Goals stated in Agenda 2030. Displaced persons often lack access to essentials. They lack legal identity, protection of the law, and ability to participate fully in the host country's economy and society. They are therefore regarded to be among the world's most vulnerable and furthest behind. But what does it mean to leave no one behind? And how are the very few refugees actually selected for resettlement? Although the literature on resettlement is growing, we know still quite little about how categories and criteria for the selection of refugees for resettlement are implemented in practice, in what has been called the black boxes of bureaucracy. Various studies have documented that from the refugee perspective, the selection process appears obscure, difficult to navigate and understand, and it seems to be guided by conflicting categories for the identification of eligible candidates. Vulnerable but able to integrate, for instance. Legal studies have furthermore traced the regularization of resettlement through soft law instruments, such as the UNHCR Resettlement Handbook, and found that the implementation has contributed to a form of legal diversity rather than homogenization. Studies have also shown that the categorization of refugees is a spider's web of cross effects, where the emergence of one label in one area can shape the meaning and use of another set of labels. For example, take the categorization of some refugees, mostly women and children, as being vulnerable and therefore deserving for protection. And this categorization of women and children as vulnerable seems to correspond with an implied categorization of other refugees as dangerous and undeserving, in particular young single men. FAFO has for the last 4 years been leading the research project, The Future of Resettlement, Vulnerability Revisited. The project has been funded by the Norwegian Research Council, and our team consists of researchers from the University of Malmö, Migrinter CNRS in France, CMI in Bergen, and the University of the Aegean in Greece. Additionally, we have collaborated with the Bishop Stuart University in Uganda and the Norwegian Defence Research Establishment. Throughout the last years, we have explored the resettlement of refugees from our various national perspectives and have shed light on selection practices and the different rationales behind. In particular, we have focused on the category of vulnerability, one of the selection criteria which has also received attention in media and public discourses. So during the project, and also in this seminar, we have asked, or we will ask, what does it mean in practice to select the most vulnerable and leave no one behind? Who are these most vulnerable? And how is vulnerability defined in the different contexts and phases of the resettlement process? Our research team has gathered a vast variety of data material. We have interviewed employees of national immigration and integration authorities in our respective countries, as well as in countries of first asylum, particularly Lebanon, Uganda, and Rwanda. We have interviewed UNHCR staff in Geneva, as well as in various countries, and we have analyzed policy documents such as quota policies, guidelines, UNHCR resettlements, handbook, etc. We have conducted ethnographic research during selection missions and had access to case documents on resettlement cases submitted to Norway. Last but not least, we have analyzed the political debates in Norway and in Norwegian and Swedish parliament. Some of our research findings have already been published, and we are currently finalizing 2 special issues, one with the Canadian Journal Refuge and one with REMI, the French-based Journal for International Migration. In addition, we will publish policy briefs now in the next few months. We are honored to being able to present to you a selection of our research findings on various areas and perspectives of the resettlement scheme. We will learn about constructions of vulnerability in Rwanda and Greece, resettlement practices in Norway and Sweden, channeled migration from Lebanon to France, and learn more about the Union Resettlement Framework. Our first presenter is Brigitte Suter, and with this I end my presentation. Brigitte will present the presentation Sweden's new resettlement policy examining the prioritization of women and girls. And Brigitte is associate professor at the University of Malmö. The floor is yours.
Yes, thank you. Okay, then I start right away. So my presentation deals with Sweden's new resettlement policy and is an attempt to explaining the prioritization of women and girls that the 2022 Swedish national elections brought about. So in 3 years ago by now, the national elections shifted power from a social democratic green to a conservative liberal government and brought, among others, radical changes to the country's long-standing resettlement program. So among others, the number of resettlement places was to reduce from the previous 5,000 annual places to only 900 places. But there was also an integration criteria that was introduced, and women and girls were to be prioritized above men and boys. So in my presentation, which is also based on an article that is soon to be published, I try to explain this prioritization of women and girls, or in other words, the statement that women and girls are more deserving of protection than men and boys. And I do this by examining the worldviews and assumptions of Swedish politicians through a critical policy analysis. Yes, so very briefly about the conceptual framework that I used in this article. So in order to account for the Swedish politicians' worldviews, I draw on feminist, post-structuralist scholarship of gender and protection and vulnerability and deservingness. So deservingness and vulnerability play a crucial role in access to protection. It's discursively constructed, but notions of deservingness are not neutral, and often the representation of one group as deserving leaves the other group as undeserving. Politicians, the media, and other societal figures shape such discourses, which influences the general public sentiments towards the deservingness of various groups. Discourses of vulnerability and suffering have increasingly become central to the governance of marginalized populations. It bolsters the self-image of states and institutions as benevolent and compassionate, but it also fosters a moral economy in which the language of suffering and empathy often trumps human rights. And there is a strong reliance on gender as a criterion for assessing vulnerability. And indeed, gender is a prominently invoked category in the field of refugee protection, war, conflict, and humanitarian relief. It's usually reduced to a strict binary category based on biological differences, with generalizing assumptions on the meaning of such differences. Refugee women in particular are repeatedly portrayed as passive victims, while in contrast, refugee men tend to be represented as unreliable at best and dangerous at worst. And relying on such stereotypical and essentializing representations leaves no room for nuances, for personal trait, or for contextual expression, and obscures both the active role of women and the suffering of men during conflict. A few words to the methods I used and the material. So the article uses a critical policy analysis to analyze policy formulations according to the problem representations on which they build. So this approach challenges the assumption that problem statements in policy are rational responses to objective issues, but conceives of problem statements as constructed representations that are shaped through discourses. So the aim of the approach is to explore these problem representations or problematizations, and to consider their inherent assumptions, their limits and silences, and their discursive and practical or material effects. And so while the policy that came after the elections that announced these radical changes in refugee resettlement, they're quite pragmatic. So I needed to go to parliamentary motions on refugee resettlement that were submitted between 2014 and 2021. And parliamentary motions are political tools that allow members of parliament to influence lawmaking, to propose new political initiatives, or to challenge the government's propositions. And most of the motions that I found, that's here on the next slide, I found 11 motions during this period that were submitted to the committee, in which members of parliament proposed changes to the refugee selection and proposed to prioritize women or girls. So I found 11 motions that were submitted during since 2018, and the vast majority of the motions were submitted by members of parliament who were then in opposition and are now in government. So they were part of the negotiation to this new policy. Yes, and it's noteworthy here that a lot of these motions, when arguing for prioritization of women and girls in resettlement, make this argument from a gender equality perspective. So at the end, I did a problem representation of both gender in refugee selection, but also on gender equality in the asylum system. So to start with, the representation of men and women in the parliamentary motions. So throughout these 11 motions, gender was problematized as a category that consists of a good gender, women, and a bad gender, men. And this concept, gender, is throughout represented as a binary category in which one group is understood to stand in contrast to the other. It was interesting to see that the term woman or women is mentioned multiple times, either by itself as a woman, or in relation to risk and vulnerability, in relation to women's situation in countries with strong patriarchal values, and in relation to their alleged difficulties in refugee camps. And this is in contrast to the term man, which is mentioned considerably less often, It's never a standalone. It's never mentioned in relation to man's vulnerabilities as refugees, as displaced person, or a specific position as man in the context. Man's vulnerabilities are only implied in relation to sexual orientation, religion, or disability. And whenever the term man is mentioned explicitly, it's done in connection to something negative, such as violence or crime. So this conflation of gender and vulnerability in essentialist terms is not limited to the worldviews of the Swedish politicians. As scholars on critical humanitarianism and refugee protection have pointed out, studies in the field have a long history of relying on gender essentialism when distinguishing innocent from non-innocent people and vulnerable from non-vulnerable. And leaning on this literature then enabled me to detect some of the silences in the parliamentary motions, namely the potential vulnerability of men in conflict in refugee camps and in patriarchal societies. A non-essentialized view on men would have allowed to conceive of men not only as violent perpetrators, but also as those fleeing and inhabiting refugee camps, trying not only to survive, but also to create a living for themselves and others. And it was also noteworthy to see that the problem representation of gender in the studied motion is strongly intersected or connected with mobility and immobility, and also with religious identities, but I only have time to go into one. So one example on this conflation or intersection between gender and mobility or immobility comes from a committee motion from the Sweden Democrats, in which the members of parliament state that resettlement is an opportunity for Sweden to seriously help those who need it the most, rather than those who have the strength, money, and contacts to smuggle themselves here. This means that the Swedish quota refugee system must primarily be used to help women and children, as well as various vulnerable minority groups. So what these members of parliament here do is to create one group, those who need help the most, to play out against another group, those who have the strength, money, and contacts to smuggle themselves here. In other words, asylum seekers. And it's a school book example of how one group's deservingness is presented in a way as to imply the other group's undeservingness. Gender here is intersected with mobility and immobility, respectively, to arrive at the binary of the deserving immobile women and the undeserving mobile men. And we see this also in the literature. There's a seminal work by Heinemann and Childs from 2011 that arrived at the same conclusions and argue that it's not gender and immobility alone that creates this category of deservingness, but the fact that this immobility in refugee camps is linked to a suspension of refugees' human rights. An encamped refugee does not invoke any obligations from states, but instead becomes subject to compassion of international humanitarian organizations and foreign governments. And now the other set of problematization or problem representation, which is gender equality in refugee protection, and this very briefly. So we see throughout the motions that this problem, representation of gender equality, is only connected to the category of asylum seekers. There is hardly any motion pays attention to the numbers of asylum seekers that are actually, the numbers of asylum claims that are actually granted, or any other immigration category, such as family reunification, for example, or labor migration. And I had a quick look at statistics, because here we see that Among the asylum grantees, men are still overrepresented, but to a much lower degree than in the asylum seekers category. We see that men are clearly overrepresented in labor migration, and we see that men are quite underrepresented when it comes to family reunification. So to sum this up, I looked at the combined effects of these problem representations, and we see here then, first, the worldviews expressed in the parliamentary motions lead to a discursive construction of deserving immobile women, the quota refugees, and undeserving mobile men, the asylum seekers. And in that sense, the restriction on admitting men and boys into Sweden can be considered a material effect of such discursive problem creations. Then, however, the way that the politicians expressed their concern for a gender balance in refugee reception warrants closer scrutiny of possible effects. The selective focus on asylum seekers, while sidelining other migration categories such as labor migrants and family reunification, deserves attention. As scholars have highlighted, how policies and practices rooted in benevolence or goodwill grants the states higher discretion and control at the expense of legal obligations, accountability, and refugee rights. The focus on asylum seekers, the group that is most clearly protected under international law, while marginalizing categories with weaker or no legal claims, such as family reunification and labor migration, suggests that the issue of refugee rights and corresponding state obligations may indeed be of concern. And here I end my presentation, and thank you for listening.
Thank you, Brigitte. The next person out is Ragnar Lillebreck, a researcher at FAFO, with her presentation Through the Eye of the Needle, How Norway Resettles Refugees.
Thank you. Let's see if I can start this presentation. All right, there we go. So thanks. My presentation is focusing on the case of Norway, and I am looking into how resettlement, as Nerina was talking about the introduction, is accessible for a very small number of the refugees worldwide by focusing on how Norwegian resettlement programs, policies, and practices define who can access protection through this channel to Norway as the receiving country. Because we know that resettlement is not a right included in the Refugee Convention, so how these programs work, which countries that accept to receive refugees through resettlement is very much up to the international organizations trying to mobilize for this type of protection, but in the end, mostly the receiving countries. They hold a lot of the power over these decisions. And there is a growing focus in the literature on resettlement about how the criteria and policies that these receiving countries apply are biased. Some call them discriminatory. Some even say that they are not only as part of the solution for the refugee crisis worldwide, but they are maybe part of the problem, and that they redefined who we accept as a deserving refugee through all these additional criteria that countries apply. And in this presentation, I will then focus on the Norwegian system. So let's look at that briefly. Norway has been resettling refugees since the 70s. It is a very long-standing program, even longer than the Asylum Institute in this national context. But the numbers are quite low annually. So asylum has overtaken resettlement in terms of arrivals a long time ago, and also in terms of political attention, I would say. But there is an annual quota set by the parliament each year that defines how many refugees Norway will accept through this channel. And then there are some legal requirements that define, of course, eligibility for refugee status in Norway. And then there's the additional resettlement policy criteria that must be met. Norway cooperates with UNHCR for the majority of the resettlement initiative. There's also some other organizations that can submit candidates to Norway for resettlement, but UNHCR is the main partner. And then Norway has the system where after UNHCR submits candidates for Norway's consideration, the Norwegian immigration authorities do a very thorough assessment of those cases based on the paperwork submitted by the UNHCR, but they also go on what they call selection missions, where they interview these refugees face to face, collect more information, and make a final decision about whether or not they will be accepted. So in this project, we have been following this system through looking at policy documents and also interviewing the participants of these selection processes from the immigration authorities and participating in 2 of these selection missions to observe how they work. And we have also received a selection of case files that contain the information collected by the Norwegian administration in a selection of cases from 3 missions that we have followed. So these documents tell us a little bit about what the policy says about who should be eligible for resettlement in Norway, and also how these policies are turned into practices and who in the end are accepted and who are rejected in the process. In this presentation and the paper I'm working on, I'm looking at this from a perspective of trying to find the institutional logics that guide Norwegian resettlement policies and practices. So basically that's looking for how this is constructed by multiple competing logics. We know that in the field of refugee protection, there isn't a lot of consensus about which refugees that deserve protection. So my assumption is that there will be multiple ideas and multiple origins of those ideas. And I'm interested in seeing how they then combine to define who Norway accepts, who is eligible for resettlement. And what I find is at least 4 logics that combine to define this eligibility for resettlement to Norway. I find a humanitarian logic that is quite strong, but also some competing logics that I have called securitizing, optimizing, and legal logics. So I will walk you through those for the remainder of this presentation and discuss how they shape access to resettlement. So firstly, we see the humanitarian logic very clearly at the political level. The way that Norway presents resettlement as being part of a humanitarian toolbox or a humanitarian commitment at the international level, how Norway prioritizes engaging through international cooperation to address refugee issues. But we also see very clearly, even in writing, that politicians define this as a tool that they can use quite freely. They say that Norway has freedom in scope and design when they engage in resettlement. So scope means the size, how many refugees Norway accepts. That is, as I said, up for political consideration each year. And it is usually adjusted by trying to look at the asylum situation and then balancing the quota against how many refugees are arriving to apply for asylum. We see also that the UNHCR is quite influential in what we can call design, especially when it comes to within this quota, who should Norway select, where should Norway go to interview and meet refugees and consider refugees for resettlement. So there is within the quota sub-quotas for different nationalities and different host countries where Norway will go and resettle refugees from. And those are often recommended by UNHCR and then put into policy by the Norwegian administration without much changes. But there's also political influence on what's called the profile. So that's how Norway additionally has some categories of priority. Currently, there are 3 that have been for a while. There's families with children, women at risk, and LGBTQ cases. And the first 2 are, of course, the largest categories. And there we also see that this humanitarian logic is bounded by the political interests. Because having those 3 as the focus of the program, by definition, excludes some other categories, as Bridget was talking about. There's also quite a strong legal influence, I would say, in the process that maybe is not so obvious at the policy level, but the basic access requirement for resettlement is that the refugee must have a claim for protection. And that claim is assessed against the Norwegian immigration law, same as you would with an asylum claim. So the UNHCR has done a refugee status determination process for each of the candidates that they submit to Norway, but Norway does another evaluation of the protection claim for each case. So this is what we see a very strong influence on the process that Norway implements when they reassess cases. They spend a lot of time, especially the UDI, the Norwegian Immigration Authority, spend a lot of time on assessing protection claims. And then that also raises some concerns. So refugees have to prove their protection needs, but also their identity and their credibility. So this introduces some risks for rejection in the process. And we see this intersecting with the humanitarian logic, for example, in the case of women at risk. So women at risk, as I said, is a category of prioritization. But the Norwegian definition of a woman at risk is a bit stricter than UNHCR's definition. UNHCR has been moving towards a more broad understanding of which women at risk should be included in this category, while Norway defines it as women without the protection of a male network or a male partner, usually. And that means that assessing this relationship status becomes a part of this, of this legal logic with its own risk of rejection on behalf of the women. Additionally, we see a few bordering logics, especially security, of course. If there's any security concerns, those might be grounds for rejection, but also in itself, presenting a false claim can be a case for rejection. Also, we see some normative assessments of the family's values, especially when it comes to gender-related norms. But I want to pay attention to the last point here, which is that Norway is quite concerned with using the available resources after resettlement in a way that will allow the program to continue. They don't want to overload the Norwegian integration system, basically. So that adds some restrictions, such as how large families Norway will accept, how many medical cases Norway will accept, how many extra needs the refugees can present and still be accepted within the program. So in the end, I find that these different logics combined they are like building on top of each other. And if we look at the system analytically, this is not how it's presented in the policy, but how we can distill it, kind of. Refugees need to be entitled to protection. They need to show some vulnerability that fits with the categories that Norway wants to prioritize. They also need to present themselves credibly and as governable citizens with the right norms, right family size, kind of the right level of vulnerability to be able to pass through the Norwegian system for resettlement. So it's not an arbitrary system, but it is a complex system. It has some biases and is definitely shaped by the national interests as well as the humanitarian priorities. I think that's all I had time for. Thank you for your attention.
Thank you, Ragna. The next one on my list is Flora Penot from Migrinter at the University of Poitiers, CNRS in France. And her presentation is called The Channeled Migration System from Lebanon to France.
Thank you, Nerina. I will share my PowerPoint. Yeah. So today I am going to present research realized with my colleague Elsa Maharaoui. We are both PhD students on migration and Lebanon. So our communication entitled The Channel Migration System from Lebanon to France, complementary pathways depicting vulnerability as the core of the right to asylum. So the aim of this presentation is to show how the vulnerability criteria is taking the place of asylum rights in the context of border management outsourcing. Through this presentation, we will show two mechanisms, which are humanitarian corridors and UNHCR resettlement, applied to the context of Syrians in Lebanon. So this presentation shows the mechanism of this replacement and how the visible tendency to harmonize the practices between different actors. So we use two definitions as given on the slide, and we also develop a concept. So by channel migration, we refers to all migratory movements which are backed by an organization in order to support the refugees in accessing asylum rights. So each mechanism has its own legal system, and migrant status can vary, but as a common aim is sharing the burden of asylum between countries. So our theoretical framework is about the border management outsourcing. So this outsourcing of border management by the European Union has been defined by two French geographers, Cédric Audebert and Nelly Romain, in an article published in 2009, where the authors draw a parallel between the terminology outsourcing in the business sector and the borders policies of the European Union or of the United States. And according to another researcher, Luisa Bialasevich, a political geographer at the University in Amsterdam, even if there is no doubt that we are currently in the era of outsourcing border management, there is a need to study the political and ethical implications of this transformation of bordering practices. Thus, this communication presents an aspect of these outsourcing mechanisms put in place by the European Union. So the asylum system implemented outside Europe by the UNHCR and the humanitarian corridors in Lebanon. So despite their declarations of good intentions, the countries of resettlements have failed in responding to the needs published by the UNHCR, and less than 5% of resettlement needs in the world are met in 2024. So, willing to find solution to the scarcity of resettlement places, the Global Compact for Refugees, endorsed in 2018 by the General Assembly of the United Nations, has reaffirmed the importance of complementary pathways in the search for durable solutions for refugees. So, moreover, the European Union Agency for Asylum differentiates resettlement organized by the UNHCR from other safe and regulated avenues for refugees that complement resettlement. By drawing a parallel between the UNHCR resettlement policies and practices and the humanitarian corridors in Lebanon, we condemn that the mechanism of the humanitarian corridors is a way of outsourcing resettlement screening capacity to the non-profit sector by relying on vulnerability criteria, in the same way as UNHCR does. As a result, we go further than two French authors, Boaga and Second, in the article published in 2019, who argue that even if the actors of the humanitarian corridors are constrained by the migration policies of states, they also support the recognition of a new inclusion categories. So, first of all, let me introduce you the Lebanese context. It is very specific. Since 2011, Lebanon has become the second country of asylum for Syrians after Turkey, with around 1.5 million Syrians registered with the UNHCR. So Lebanon is a non-signatory state of the 1925 Convention, signed, and you have a memorandum of understanding between the UNHCR and the Lebanon state, signed in 2003. And it's produced that Lebanon is a country of a transit for refugees and should not be considered as a country of refuge. And according to Michael Kagan, there is a legal anomaly regarding the refugee status. In fact, the UNHCR issues registration certificate to the acknowledged refugees through the prima facie procedure, and it does not have the legal means to give the refugees the right of asylum. Therefore, Syrians in Lebanon are not considered as refugees, and the only way for them to seek asylum is to ask for it in another country. This means that there are no local integration prospects. Thus, we must not forget, even if the regime of al-Assad has fallen, not all Syrians can go back to Syria. And on this point, EUAA recently published a report on the different reasons that can justify the right of asylum of Syrians. So how can Syrians be refugees? There is where the supervised migration intervenes. So in this channel migration, as well as being eligible for international protection, applicants must fit into the vulnerable categories defined by the promoting organization. So vulnerability thus becomes the primary condition for benefiting from this form of channel migration. The UNHCR Resettlement Manual lists 7 main categories of vulnerable people, such as women at risk, victims of persecution, the sick, people with disabilities, etc. And the humanitarian corridors refer to this manual through the bilateral memoranda of understanding drawn up with each host country, while at the same time having some flexibility with the humanitarian teams on the ground in Lebanon. So our main question is how channel migration mechanism participate in redefining the asylum system, supplanting the refugee status, and thus contributing to its ineffectiveness against other criteria such as vulnerability. So these two French authors, Yasmine Boaga and Raphaël Second, said that the vulnerability used in the humanitarian corridors is broader and malleable than legal definition of refugee status. So unlike resettlement, candidates for the humanitarian corridors are subjected to a double assessment in Lebanon. First, by the organizations that organize the corridors, such as Sant'Egidio and the Fédération de l'Entraide Protestante en France, and then by the French consulate in Beirut, which interviews the candidates a second time, checking for security risk. So once candidates have been selected, they are issued with a D visa for asylum, which allows them to travel to France. This means that people arrive on French soil as asylum seekers and not as recognized refugees, as in the case with the resettlement procedure, which has already recognized refugees in Lebanon during OFPRA mobile mission. So, to conclude, Lebanon holds a special place as a country of departure in this supervised migration. And since the 70s, the dominant humanitarian discourse linked to the migration policies has been replaced by a highly discretionary migration management discourse. States are tending to subcontract the management of their migratory flows to private actors. And these actors, who have become veritable migration managers, use vulnerability as a central element in their assessment of selection of candidates for this supervised migration to Europe. Vulnerability is used to justify policies of labeling and categorizing vulnerable refugees, and this definition of vulnerability maintains a lack of clarity on which those involved are aiming as they intervene prior to the decision by the host country. And thank you for your listening.
Thank you, Flora. Our last presenter before the break, because we do have a break, is Johan Eksted, currently a postdoc at the Université Libre de Bruxelles. And his presentation is called the Union Resettlement Framework, and it has a longer title, which is called A Strategic Asset, an Alternative to Asylum, or an Expression of Humanitarian Values. Johan, the floor is yours.
Thank you, Narina, and good morning, everybody. I don't have a PowerPoint to share in case you're wondering why there's nothing appearing on the screen. But I will tell you about a paper that I published last year. And it's about the Union Resettlement Framework, or the Union Resettlement and Humanitarian Admissions Framework, as it's called. This law is a regulation by the EU, and it's essentially a common legislative framework that sets procedures and criteria for resettling refugees to EU member states. The aim, to use the EU's own language, is to harmonize national approaches. And it was presented by the Commission as a part of the new Pact on Asylum and Migration, which I'm sure many of you have heard about. You could say in general, the framework, it reflects the Commission's aim of promoting alternative pathways, legal pathways to the European Union. And the research question that I had in this paper, it's really quite simple. It is, why does the European Commission want to promote resettlement? And to understand this, I did an analysis of the travaux préparatoires, or the negotiations, if you want, ahead of the law between the European Commission and the European Parliament, and then also an analysis of the legal text itself, the final text, which was adopted last year. The background of this research paper is that this question of why to promote resettlement, it's actually quite a classic question in the study of resettlement. But unlike my paper, most other research previously, they have only looked at why states want to resettle refugees. So why does the United States want to resettle refugees? Why does France want to? Why does Norway want to? And so on. And there are many theories about this. There are probably different answers depending on which state you're looking at. But I'm going to present 3 classic theories of why states want to resettle refugees. First of all, it could be a strategic asset. For example, it could be leverage in negotiations with third countries that you offer to resettle refugees from that country in return for another favor, politically or diplomatically speaking. Another very common reason that is presented in the literature is that it's an alternative to asylum. States, they generally prefer resettlement over spontaneous asylum seekers because it's more predictable, it's controllable, and it's also considered to be better from a security standpoint, since the refugees are vetted before they are admitted. Finally, there's a common idea that it is in fact simply an expression of humanitarian values, that it is to show solidarity with refugees, to show solidarity with countries that host a large number of refugees. In a sense, it's simply a protection tool for vulnerable groups. The research on why the EU has been doing this has looked at these questions before. You have found classic examples of how it is used as a strategic asset. The most famous one is the 2016 EU-Turkey statement, where the EU offered to resettle Syrian refugees to the European Union, and among other things, including development aid, for example, Turkey accepted to control the border with Greece more thoroughly. In the communication from the Commission, the alternative to asylum is very common. They talk about safe and legal pathways in order to prevent risking lives at sea. It's better for the refugees, they claim, to be resettled than to seek asylum. This, however, has been put into question since the number of refugees resettled is so tiny in comparison to the needs. Then, of course, it is not fundamentally an alternative to asylum, since the resettlement quota would have to be so high to actually alleviate the need for entering the EU irregularly. On humanitarian values, this is, of course, very much present in the European Union's official communication around resettlement programs. But it's also, I should mention, in the research done on this, it shows that it is present in the communication, but it also goes hand in hand with a migration control logic in the communication. They're often mentioned side by side. So moving on to my analysis, indeed, you can see that in the communication from the Commission around the Union Resettlement Framework, this new law, humanitarian values are often stressed. This is essentially the right thing to do to increase the resettlement quota. But in the travaux préparatoires and in the final act, I would say that both the alternative to asylum logic and the strategic asset logic is much more present. And if you would like to know more details about this, you're welcome to contact me or find this article, which is published in Current Issues in Migration Research. But I will simply give you a quote, one of the quotes that I found that I think really captures this. And this quote is from the first text that the Commission sent to the European Parliament to present the idea of a Union Resettlement Framework. And it reads like this: the framework will help reduce the risk of a large-scale irregular inflow of third country nationals and stateless persons to the territory of the member states, and thereby reducing the pressure of spontaneous arrivals on the member states' asylum systems. It's clearly the alternative to asylum. And then it continues further down. The framework will help achieve the Union's foreign policy objectives by increasing the Union's leverage vis-a-vis third countries. It clearly presents this as a way for the European Union to be given a strategic asset in negotiations with third countries. So just in short, the framework frames resettlement as a way to save lives at sea and reduce Mediterranean deaths, let's say, even though we know that the practical effects are very much constrained by the limited numbers that are resettled in the end. The notion that resettlement is a tool to curb irregular migration and strengthen foreign policy leverage is made explicit in the analysis that I made. It is clearly a tension between three motivations. You can see the strategic asset as a dominant driver tied to external relations. The logic of alternative to asylum is perhaps more narrative than practice, but it's there. And in the communication, we also see it as an expression of the humanitarian values of the European Union. And before finishing, again, this is of course just a brief presentation. There's much more to it. I can happy to share the text with you, but I want to finish off saying something that is very important in all my research on resettlement, and is that EU resettlement policy can be analyzed in this somewhat critical way, but that is not supposed to diminish the fact that resettlement is a positive policy, especially for the individuals that are resettled. But even positive policies can sometimes require this more critical scrutiny. And with those words, I would like to thank you for listening, and looking forward if you have any questions in the Q&A later.
Thank you, Johan. We would now give you 10 minutes to stretch your legs and maybe take a cup of coffee, and we will be back here at 10 minutes past 10. And I hope you join us in the second part, which is as interesting as the first.
All right, welcome back, everybody. The next presenter is Ingunn Bjørkhaug, researcher at Fafo Institute for Labor and Social Research. She will be presenting her paper, Navigating Vulnerability and Integration. Ingunn, go ahead.
Okay. Okay. This presentation is based on my article, or our article, that Kine Bekkevold and I wrote together, and is published in Refugee Survey Quarterly, where we examine how refugee resettlement from Rwanda under the medical needs category, and we focus on how this criteria of medical cases affect who is included and who is excluded. We also ask what this means for the broader policies of burden sharing. So our central question is, how do medical needs criteria affect the selection of vulnerable refugees in UNHCR's resettlement program in Rwanda? And second, what are the implications for resettlement as a strategy for international burden sharing? In other words, we're interested not only in the medical cases, but also how they connect to global refugee governance. And this is based on an interview with UNHCR, with Save the Children, with doctors and practitioners in the different refugee camps in Rwanda. It was made on site and also on Teams interview, following up over a period of 2 years. So, at the time of our study, Rwanda hosted around 133 refugees, but only 50 of these were resettled based on medical needs. In 2023, approximately 7,800 refugees departed from Rwanda for resettlement. In 2024, the year after, the number was a bit lower, around 5,600 departures. But we all know that this important change of 2025, where the US has suspended its admission, also changes this game quite a lot. This is significant because the US has been the largest resettlement country, and means that approved cases are now on hold of many of the selected refugees, and global resettlement capacity is even more constrained. But this brings us to what this article has used, which is the concept of promising victimhood, introduced by Natalie Welfens. This means that resettlement is formally about protecting the most vulnerable, but in reality, refugees must present themselves as both vulnerable and promising. That means they have to show that they're at risk, but at the same time demonstrate their power and potential to recover, to integrate, and to contribute to the society they come to. Natalie Welfens describes how policies and practices require refugees to demonstrate that they're at risk, yet willing and able to overcome law-abiding, self-sufficient, and culturally adaptable members of the host society. And this is a paradox that runs through the entire resettlement program, and we also show how this is quite evident in the medical cases. So, according to UNHCR's handbook, 4 factors guide the medical referrals. First is the diagnosis. The condition that the patient has must be severe, life-threatening, or seriously impairing their daily life. Second, there's the treatment. It must also show that adequate treatment is not available in the country of asylum. And third, there's the issue of prognosis. There must be a reasonable expectations that the condition will improve if the refugee is resettled and treated abroad. And finally, the ethical informed consent is that the refugees must also explicitly agree to resettle. However, in practice, the prognosis criteria is closely linked to the integration potential. Doctors and caseworkers in Rwanda express how they experience that the states are more likely to accept refugees who can become healthy and self-reliant. So this integration aspect also enters indirectly, even though not formally part of the criteria of medical needs. So how does this play out in practice in Rwanda? Well, first, medical resettlement can only start if a camp doctor refers a patient to the UNHCR. Importantly, UNHCR only accepts referrals which are made by their own partners. So the refugees cannot come and show their own medical needs, but they have to be referred. And here we face a paradox, because refugees must be then robust enough to navigate a long and quite complicated referral process. But they also have to be unwell enough to qualify for this referral. In many camps, there's only one doctor among 15,000 refugees, so even just getting the first appointment may take months. And then after the referral, the case goes to a medical committee and then to the UNHCR before it's shared with the resettlement countries. This waiting time is long and very uncertain. For some, health conditions worsen during this period, some dies before they're even able to departure. And this prolonged waiting can also create quite a lot of frustrations and conflicts between the patients and the doctors. And then there's the prognosis criteria. Only those with a good chance of recovery are prioritized. This means that refugees with chronic or fatal conditions are often excluded, even if they are among the most vulnerable in the camp. So here lies another paradox. The category that is supposed to prioritize those in greatest needs often are excluded because their prognosis is not considered good enough. In this article, we write how the very process meant to provide relief can exacerbate the suffering it aims to alleviate, highlighting the complex interplay between health, bureaucracy, and time in the lives of the refugees. While the system aims to assist the most vulnerable, delays in resettlement often prolong their suffering, undermining its humanitarian objective. So, publicly, resettlement is framed as prioritizing the most vulnerable, but in practice, there's a preference for those who are most likely to recover, highlighting a wide attention. It's presented as a humanitarian solidarity, but in practice, there's a gap between the humanitarian ideals and the political and practical realities. And I will read a quote that one of the doctors shared with us from Rwanda, when he said that, so you have limited opportunities. You have to weight them carefully. There are certain illnesses that you find which make people quite vulnerable and in need of resettlement. But in the end, you cannot resettle them because you have to prioritize someone with a better diagnosis. So, to conclude, and you can read more in depth about this in the article, but we conclude that UNHCR and its partners must constantly balance this humanitarian objective with the expectations of the resettlement countries. And this produces what we call a paradox of choice. The most vulnerable refugees may be precisely the ones least likely to be resettled or receive adequate treatment. So resettlement is available to only a small fraction of refugees, but it also leaves out the most vulnerable refugees. Thank you.
Thank you, Ingunn, for a nice and short presentation. Next out is Vasiliki Kramida. Are you with us, Vasiliki?
Yes, I'm here. Can you hear me?
Yeah. So Vasiliki is with the University of the Agen. She's presenting a paper co-authored with Johan Ekstedt that you've already met today. The floor is yours, Vasiliki.
Great. Just a moment to share it. So please tell me if you can see it. Okay.
Perfect. Yeah.
Great. And the changes, right? Great. So hi, everyone. I'm in another seminar. This is why I wasn't able to attend from the beginning. So our presentation with Johan is titled Between Protection and Exclusion, the Bureaucratization of Refugee Vulnerability in Greece. In the next 10 minutes, I will be discussing how the role of vulnerability has evolved in the Greek asylum system, especially following the EU-Turkey statement of 2016. And a series of legal reforms introduced by the Greek government after 2019. I should mention that this is work in progress. This will be submitted as a paper soon. So the main questions that we've been asking are: how is vulnerability defined, interpreted, and applied in Greece? How have the bureaucratic practices of assessment changed over time? And what are the wider implications of using vulnerability as a screening tool in refugee reception? Let me start with the legal changes. Between 2019 and 2022, several laws progressively narrowed the categories of people considered as vulnerable. Some groups were removed altogether, such as women that have recently gave birth, and others were sort of redefined. For example, people with post-traumatic stress disorder were no longer recognized as such, but only if it was framed as a cognitive or mental disability. And importantly, being classified as vulnerable no longer guaranteed transfer from the islands to the mainland facilities. One expert we interviewed described the experience as a bureaucratic hell. Another explained that in 2016, being recognized as vulnerable was crucial because it meant relocation to the mainland. After 2019, this pathway sort of closed, leaving many trapped on islands like Lesbos, regardless of their classification. So if we look at the broader picture, the trends in arrivals indicate why this shift matters. So here you can, in this graph with the black with a black line, you can see the absolute number of third country nationals arriving in reception and identification centers. The majority of refugees arriving in Greece go through these reception centers, they called RICs. You can see it here, this is the percentage of people going through these reception centers. Most of them, as you can see in this graph, are sea arrivals rather than land arrivals. So this means that camps in the islands are bearing a significant portion of income flows. Over the past decade, we see fluctuations in the total arrivals, but also the number of those categorized as vulnerable has shifted. When we consider these trends along with some policy milestones and situations like the COVID-19, it is reasonable to point out that legal reforms and policy shifts directly affected not just assessment procedures, but who is seen as vulnerable in this system. Specifically for the vulnerability categories, as the diagram shows here, unaccompanied minors consistently make up a significant proportion of the vulnerable third country nationals. I should say here that the data come from the Ministry of Asylum in Greece. What we see here is that also victims of physical abuse declined up to 2020, but rebounded after 2021, while single-parent families remain a sizable group. So it is important to know that many asylum seekers fall into more than one category of these vulnerability types. For example, being both a survivor of violence and a single parent. While the system allows for recognition of multiple vulnerabilities, in practice, this is not always systematically recorded or acted upon. Contributing in some cases to inconsistent protection outcomes. So these changes play out against the backdrop of significant operational challenges. In practice, vulnerability assessments have been carried out by multiple actors, often with staff shortages, insufficient training, and a lack of interpreters, especially female interpreters for gender-sensitive cases. During COVID-19, restrictions further limited the ability of staff to conduct meaningful assessments, and the rigid and reductionist frameworks used in many cases not only failed to capture the complexity of trauma, but in some cases exacerbated it. So let me illustrate this through the Lesbos case study. Here, vulnerability functions in a paradoxical way. On the one hand, it can open the pathway to certain vital supports for the refugees. On the other, it is experienced as a really messy bureaucratic process. Misclassification is common here. In many cases, vulnerability is used mainly to argue against detention rather than to guarantee protection. This creates what we understand as a dual reality. Refugees themselves are highly aware of the stakes involved in being labeled as vulnerable. Some resort to strategic coping strategies, like in some cases self-harm or emphasizing particular aspects of their story during their interviews in order to fit the system's rigid categories. So of course, the implications of this go beyond Greece. They are related directly on the EU's international obligations in refugee protection and human rights. First, we see that in order to conclude this, we see that the vulnerability assessments are often inadequate or missing altogether. Even when they do exist, they frequently fail to trigger the special procedural guarantees that are meant to lead to. Second, vulnerability has become less a tool of protection and more a mechanism of gatekeeping. At the borders of the EU, it has been instrumentalized, used as a migration management tool rather as a safeguard for rights. The effects are narrower categories, weakened guarantees for those who need them, and inconsistent outcomes. Refugees who should receive protection face exclusion in some cases, while practitioners are left to navigate an increasingly rigid and contradictory system. So to conclude, the Greek case shows us the dangers of bureaucratizing vulnerability. Instead of functioning as a bridge of protection, it often becomes a barrier. So thank you. I hope I was on time. My colleague Johan will be here if there are any questions. And thank you. Thank you very much.
Thank you, Vasiliki. Perfectly on time. And a very good reminder that operationalizing and assessing vulnerability is not just a difficult part of the resettlement system, but also of responding to the needs of protection seekers in the Asylum Institute as well. So thank you very much. The final presentation today is by our project manager, Narina Weiss, that you met already. She's a researcher at FAFO, Institute for Labor and Social Research. After her presentation, we will have a Q&A, so stick around for the opportunity to ask questions to the researchers if you would like. And Narina has the provocative title, Sacrificing the Few to Save the Many, or the System. So let's hear what she has to say.
Thank you. In my presentation, I zoom in on Norwegian resettlement officers and how they prioritize and select refugees for resettlement to Norway. And I'm particularly interested in those cases where rejected refugees are considered particularly deserving protection. And leaving them behind causes dilemmas of considerable moral character. And I argue that such complex ethical dilemmas make visible the many moral tensions imbued in the resettlement system at large, and in the Norwegian selection process more particular. And as you know, in Norway, 3 different agencies are involved in pre-screening, interviewing, and selecting the refugees. The Norwegian Directorate of Immigration, the UDI, has the main responsibility for assessing the cases presented by the UNHCR with a focus on the overall protection needs and the compatibility to the selection criteria. The Norwegian Directorate of Integration and Diversity assesses the refugees' needs and qualifications, as well as their ability and willingness to become active citizens of the Norwegian state, and the police caters to the Immigration Directorate and assesses security issues and identity. And upon acceptance to Norway, refugees are resettled in municipalities. The integration and settlement of refugees is something the municipalities do voluntarily. And it is up to the selecting directorates to ensure what they call a healthy balance between the promising refugees, as Ingunn has talked about, who are expected to quickly integrate and become active members of society and the labor market, and those refugees who will not, and who are expected to become a financial burden to the municipalities that house them. So there are several criteria that as we also heard Ragnar talk about, it's the vulnerability, the compatibility to society, security issues, and not least capacity issues. That means that refugees do not only need to have the right type of vulnerability to fit into the vulnerability criteria set by the UNHCR and the Norwegian state, they also need to have the right amount of that vulnerability in order to be eligible for selection to Norway. In other words, there are certain limits to the vulnerability, and refugees may be too vulnerable to count. And on the basis of 3 example cases, I will show how Norwegian resettlement officers justify the decisions and the strategies they use to mitigate potentially negative effects for the refugees, for themselves, and the larger resettlement system as such. And in all 3 examples, the refugees are considered vulnerable and deserving, and as the quote on the initial slide says, there are cases that really need to come to Norway, but whose chances to actually come to Norway are scant. The first case I want to talk about, I call it manipulating the system at home. Some of the cases that the UNHCR presents to the Norwegian mission are families with mentally and physically disabled children. Whether or not these families are given access to resettlement depends not so much on clear-cut categories, but rather on the resettlement officer's ability to mobilize the bureaucratic leeway. The first case we learned of during our fieldwork was a family with a deaf child. The family was rejected already during the pre-screening process. The integration resettlement officers had advised the immigration resettlement officers to reject the case. The resettlement and integration of a deaf child was considered too costly, the sign language interpreters and special schools. And in light of admission already made that year, the integration resettlement officers did not want to burden the municipalities utterly with another child with special needs. Later on that year, during a selection mission that I followed, resettlement officers were confronted with a similar case, a single mother with several children, one of which was a child with severe mental and physical disabilities. During the pre-screening, the immigration resettlement officers had again conferred with the integration colleagues. The latter did first approve, then upon further reflection, suggested rejection. When the immigration resettlement officers again probed into the decision and asked whether the integration officers could reconsider, they did. The woman had already family in Norway that gave the necessary leeway to act. The resettlement officers reached out to that family and asked, off the record of course, whether they would be willing to step up for their sister if she was accepted. The family agreed. In a second, even more off the record step, the integration resettlement officers reached out to the municipality that already was housing the relatives and asked whether the municipality would be willing to accept a single mom with a disabled child and a network in the municipality. So they stressed in the communication with the municipality that there was already a network that could help and take some of the caring load. The municipality agreed to this. Hence, the woman was invited for the selection interview and the family was accepted to Norway. The second case I want to present, I call it relying on the system out there. And during interviews, during selection missions, the resettlement officers assess the refugee stance on violence. Resettlement officers know that the use of violence is more common and socially accepted in most of the countries from which they resettled. Therefore, they mainly assess the refugees' willingness to learn how to raise their children without the use of violence, which then is evaluated as part of the assessment of their compatibility to Norwegian norms and law and rules. So, although this is more kind of a theoretical question maybe, or at times resettlement officers identify cases of severe domestic violence, both against the woman, but also against the children in the family. And albeit the caseworkers are acutely aware of the vulnerability of those women and children, they are often unable to select them for resettlement. The fact that one of the family members has actually acted contrary to Norwegian law, being guilty of perpetrating domestic violence, makes it impossible for the resettlement officers to accept the case. And this is due to that a fundamental principle of refugee protection is the unity of the family. It is therefore impossible to reject only one person in a case and accept the rest of the family. Resettlement officers therefore depend on the UNHCR to have protective measures in place for immediate relief of the victim, such as shelters for victims of domestic violence or legal prosecution of perpetrators of violence. Resettlement officers are also dependent on the resilience of victimized adults to separate from the perpetrator in order to be categorized as a woman at risk, and thus to have a chance to again be suggested for resettlement to Norway. And in cases where the children are the primary victims of abuse, maybe even from both parents, there seems little the resettlement officers can do other than pray and hope for the best. The third case has a quite provocative title. It's about persons with medical conditions that are too advanced to be healed. And this feeds into Ingun's paper and is an example about the vulnerability category of medical cases. So as Ingun already told you, in order to be categorized as a medical case, the refugee needs to have a medical condition that can be improved. This means that the refugee does not necessarily have to have a prospect of healing, but it is a precondition that the patient may at least undergo life-saving treatment in Norway and become better. That means if people do have medical conditions in advanced stages and the improvement of the condition cannot be made probable, they will be rejected. And in the interviews, the resettlement officers seem particularly affected by those cases where the medical patient is a child. There seems also nothing the resettlement officers could do to alleviate that kind of suffering. Unlike in cases of domestic violence, where they at least could pretend that there was a security net out there in the form of UNHCR measures or shelters, and there was a future hope that the women and children might be resettled without their abuser, there was absolutely no hope for the children in the medical cases. They could not be treated in Norway as chances for success were too low, and there was no adequate medical treatment for the condition in the country of first asylum. Resettlement officers knew that by rejecting the case, they left the children to die more or less painfully. In spite of the ambition to also reach the most vulnerable through the resettlement scheme, some refugees are deemed too vulnerable or vulnerable in the wrong way to be eligible for resettlement. These cases reveal how perceptions of cost and risk are shaped not only by policy and politics, but by a deeper collective understanding of responsibility. In Norway, this plays out in the tension between the desire to do good and the realities of what is deemed possible, given both the expansive promises of the welfare state and the financial way of including those considered most vulnerable. And this dilemma is made more acute by the responsibilities placed on the municipalities, whose autonomy and capacity limits profoundly impact resettlement decisions. Yet there is another layer, one that is often overlooked. And I would argue that at the heart of resettlement work lies a continuous attention to human suffering. And this attention is not merely a background concern. It shapes decision, it generates moral distress, and it underpins the collaborative structure of resettlement practice. At its core, resettlement work is shaped by the tension between care and control, and a space where human suffering is neither ignored nor easily resolved, but continuously present. Thank you.